Hi and welcome. Thank you for joining us today to learn about the Baystate Pediatric Palliative Care Program. My name is Michelle O'Neill. I'm the manager for the program, and you'll be hearing from myself and many of our team members today to learn more about the Pediatric Palliative Care Program at Baystate. So first, I like to say we are all in this together. We provide a number of services to children who have complex medical needs and life-limiting illnesses, and we work collaboratively with the existing care teams. We do not replace any existing providers. We work together to provide care coordination and help to make sure that we're meeting everyone's needs. First, I wanted to give you a little bit of history. Back in 2000, the American Academy of Pediatrics got together and wrote a vision statement for pediatric palliative care. And what they said is that they envisioned this group of people who would work with children and families at the time a child is diagnosed with a life-limiting illness and would continue to provide support for that child and family throughout the trajectory of a child's illness, whether that means through adulthood, through end of life, or through cure. In Massachusetts, we have a community-based pediatric palliative care program known as the Pediatric Palliative Care Network. All of the programs are funded through the Massachusetts Department of Public Health. There are 7 programs in the state, and for those of you in Western Massachusetts, we here at Baystate cover Hampden, Hampshire, and Franklin counties. All of the employees that work as part of our program are Baystate employees, and we provide services in the family's community and primarily in the home. So we're able to come to you and you don't have to go to additional appointments. We come to you to meet you in your home or other places in the community where you would like us to be. So the overall goal of the Pediatric Palliative Care Network is to improve quality of life for the entire family. And we have a variety of services that we offer from a variety of different disciplines, and everybody approaches that goal slightly differently, but the whole family is included. We serve to meet the unmet physical, emotional, social, and spiritual needs of children and families. The admission criteria for this program includes individuals during the perinatal period up until age 22. Individuals must be a resident of the state of Massachusetts and have a life-limiting diagnosis that is confirmed by a physician. There is no requirement regarding life expectancy for eligibility. Eligibility requirements to participate in this program includes living in the state of Massachusetts and also for a child to have a life-limiting diagnosis. That means conditions that there may be a cure possible but not certain, conditions for which there is no known cure but treatment may increase life expectancy and quality of life. Conditions for which treatment is palliative from the beginning, things like genetic or neurodegenerative disorders, mitochondrial disorders, or conditions for which is not progressive but may cause life limitation. The core principles of the Pediatric Palliative Care Network include pain and symptom management, family-centered care, collaboration with pediatric services, psychosocial support, sensitivity to cultural specific needs. An interdisciplinary team forms a caring community, flexibility, and we focus on living life and living well.
Hi, everyone. I'm Margie, and I'm one of the nurses on the Pediatric Palliative Care Program.
Hi, my name is Megan. I'm the other nurse on the Pediatric Palliative Care Program. We're here to talk to you about the role of nursing.
So the role of the nurse on the PDPAL program is to provide support and guidance around your child's healthcare needs. During our home visits, we provide a clinical assessment, all the plan of care that is consistent with the child and the family's goals. So during our home visits, we will come up with a plan of care to help your child and your family. We do provide family-centered supportive care during each visit, and we help with symptom management. So if your child is having any symptoms, we will contact the physician and help guide you with any needs that you may have. We collaborate with the pediatrician and other providers to coordinate care, and we can accompany your child to any medical appointments as needed locally to help provide support during those appointments. So if you want to hold the child, and we can listen in and ask questions during these appointments is often helpful. We guide families regarding upcoming medical appointments, new medications, and new diagnoses.
And we can also help your family to organize all the different medical appointments that you have. We know you have a lot of different providers, and it can often be hard to keep track of where you have to be when. If your child is hospitalized, we can provide support to your family in the hospital locally. Or if you're out of our service area, we can provide support, phone support, telehealth, when you're in the hospital. We're able to collaborate with the inpatient team to help provide continuity of care, so they're aware of what your goals are, and provide advocacy in all different ways in the hospital, with your medical providers, with school. We're also able to help your family seek the skilled nursing care needs that you need in your home, whether that's private duty nursing, skilled nursing visits, a home health aide, or a PCA. We can help you on that search. We do not provide the skilled care, so we are case management. So our role of the nurse is not to come into the home and do the care, but we can help you find the care. And that's the role of the nurse.
Hi, everyone. My name is Nori, and I'm one of the social workers.
Hi, I'm Kate, the other social worker. And part of the social work role is to provide emotional support to our families. We also provide psychosocial education and counseling for all the family members. We're here as another layer of support for you as you adjust to your child's illness and all of the stressors that come with that in managing your child's complex medical needs. We also connect families to community resources. If we don't know the answer, we'll find it for you. That's part of our role. And we can also be a support in school advocacy for your child.
We also do a lot of care coordination with community providers and provide a lot of advocacy as needed. And we also do provide support with advanced care planning and end-of-life support.
Hi, I'm Bridget.
I'm Nicole. And I'm Kristen. We're the child life specialists. And child life specialists can take on many different roles. But when we are signed on to provide support to a family on our service, all the children in the family are included. So that can be the patient, siblings, if there's other close family or friends that are very intertwined into this family, we can also help provide support to them as well. Our services look, again, different depending on the family and the patient, but it's surrounded by play. Play is really the heart of what we do, and anything that we need to address or support the family through, we often will use some kind of playful method or activity. It can be therapeutic play, medical play, or very developmental specific play that has a purpose. There's a goal behind it. And so for some kids, it looks like giving them an opportunity to express themselves or engage in something they just love to do, like art. Or, we also can provide space for them to explore something new that they might not get to do if they are sort of stuck in bed or stuck at home or feel, like they want to be a kid. Give them space to be a kid and do something fun. Doing developmentally appropriate diagnosis education can also be a space that we can help the family
with the language to use, with understanding their own diagnosis or the diagnosis of a sibling or a family member. And that education and support is really important throughout their time on our service, because say they've been with us for years and that a patient joins our service and then we have them for years. As they grow and develop, their understanding of themselves or of their sibling is going to change over time. So that's something that we can address as different milestones or stages come up. Preparation and support for procedures or treatment changes can also be helpful if a patient or a child has, say, a surgery coming up or a new procedure, something or that they have had before and have really struggled with or had some challenges with. We can help maybe, for example, make something like a social story where we create a little prep book for them to help them understand what's going to happen and when it's going to happen and how it's going to happen, to help reduce the stress that might come along with something like a surgery or a procedure. Emotional support for children, adolescents, and the family. So again, that might just be meeting them where they are. If there's a certain stressor in the moment, we are a part of the team that works with our colleagues. Sometimes it's working alongside a social worker or alongside music therapists to help provide that emotional support. Bereavement support also can look, again, very different depending on the situation and on the family, but we are able to provide that support leading up to a death of a patient or family member and helping build their legacy and helping giving them a sense of maybe control around a situation that feels very out of control, or giving them a role in a space where they might feel a little left out or misunderstood, or might have questions they feel nervous to ask. And so that support, again, can be for the child, the patient, or for the siblings or the family members. And then special events is the fun. Child life, that's kind of like the known theme within our group and within the field of child life, that we bring the fun. Like, our bag is usually full of fun. And so we also try to create opportunities in a special event sense when we can do them in person, or if we can create some virtual experiences to connect our families to one another and give an experience for the kids and families that we support, you know, around maybe a holiday or a theme. Like, we have some ideas in our bag at the moment around summer fun and providing something special and something that's adapted to our kids and families that they can enjoy.
Thank you. We look forward to working with you and your family.
Hello, my name's Tim. I'm one of the music therapists for the Baystate PD Pal team.
Hi, my name is Joseph, and I'm another one of the music therapists on the team as well.
And I am Amy. I am our third music therapist on the PD Pal team. So for music therapy, we are able to work with patients, their siblings, or the caregivers. Whoever wants to utilize music therapy services, they are available to them. So some of the things that we do in music therapy include managing pain and stressful situations. We might provide opportunities for motivation, stimulation, and relaxation through music experiences. And those needs can change from day to day, and we can address them however they present from day to day. And we also encourage creative, emotional expression, processing, and regulation through music.
In music therapy, we can also support socialization and family bonding through musical play. We can support development through music experiences, and also we can provide bereavement support and legacy building. One of the things we offer are heart songs, which we can take a recording of a heartbeat of your child, and we can match that with a song of significance and pair them together in a recording that can be provided to you. Yeah.
And some other things that we can do and utilize are songwriting for processing and expressing of various feelings, whether they be happy, sad, grief, depression, mad, any feeling that is there, we can use songwriting. And one special thing that our program has is GIM, which is Guided Imagery in Music, which uses Western classical music and creative expression for helping to process varied emotions. And we utilize that with our parents and caregivers specifically. And that's the music therapy team. So we hope that we get to work with you and your families as soon as possible.
Good morning, everyone. I'm Amber Lee. I am the massage therapist for the PediPal program. I will be working with you and your children throughout your time in the program. Massage therapy is something that we offer to both parents and patients, which I am super excited about. Not all programs do. We do need a physician's order in order to receive massage therapy, but once all that paperwork is done, we can get started. There's tons of benefits for massage therapy, and some of them are decrease in musculoskeletal pain, an increase in body awareness, an increase in circulation for healing. Massage therapy can also help to boost the immune system, which is a huge benefit. Decreasing cortisol levels. This is a hormone that we often hear about. It's a stress hormone, and massage therapy is great for that. If you're experiencing or your kiddo is experiencing any sort of gas or intestinal issues, massage therapy can be used for that as well. It helps to promote better range of motion and flexibility within the body, and use of our ligaments and limbs. And best of yet, it promotes better sleeping habits. That is just a few of the great benefits that massage therapy has to offer, and I look forward to working with all of you.
Hi, my name is Josh Velez, and I'm with Spiritual Care. Here, we try to promote the spiritual well-being and a better life experience for all of our patients and families. We perform spiritual assessments with pertinent interventions. These interventions may include music, storybooks, games, crafts, attentive listening, and prayer within the family values and faith traditions. We also emphasize patient and family strengths.
We also offer volunteer services for families involved in our program, and they are based on your family's needs, may include volunteers for play and companionship for any of the children in the family, may include Reiki or distance Reiki for the child who is our patient and or parents, may include pet therapy as part of special events, massage, help with special projects that families may have related to their child, parent helpers, and sometimes they help us out around the office with administrative assistance. Sometimes on our program, we do have children that come to the end of life. And when that happens, our services do not end. We're able to continue to provide bereavement services to families during the initial bereavement period, which is at least 13 months and usually up to 15 months worth of time. When we work with a family during the bereavement period, we work with you to develop a individualized care plan. And based on that individualized care plan and the needs that are identified, you may work with a social worker, a child life specialist, music therapist, and or a spiritual care counselor. And again, based on the needs that you identify would depend on who would be involved in your family's bereavement services. For our program, we are able to take referrals from just about anyone. Here's a list of folks who give us referrals, but anyone can call, a community member can call, a family member can call, parents can call, physicians, anybody in the healthcare system can make a referral to our program. When we get a referral, the process is that we usually verify that the child is in fact eligible for our services. And once that eligibility is confirmed, we'll reach out to a family, describe the services, and go from there. If you're interested in making a referral, you can contact Michelle O'Neill, that is me. There's my phone number. You can call me on that number or send me an email through baystatehealth.org. Dr. Sarah Freebert summed up what pediatric palliative care really is all about. She said the goal is to add life to a child's years, not simply years to a child's life. Thank you so much for watching today and learning about our Baystate Pediatric Palliative Care Program.